Hello, I'm Hartford Healthcare's Tina Verona. Every year, 1 million people undergo hip or knee replacement surgery, and many of them choose to have it done robotically. Joining me is Dr. Durgesh Nagarkatti from the Hartford Healthcare Bone and Joint Institute at Hartford Hospital. Dr. Nagarkatti, you use robotics to perform this type of surgery. How is that helping patients?
Robotic surgery has revolutionized the total joint replacement surgery at the Bone and Joint Institute. We have been at the forefront of performing robotic surgeries over the past several years, and we have seen that performing robotic surgery has made us position implants in a much more accurate way so that it leads to a better outcome in terms of the survival rate of these implants and also a better outcome for the patients.
Now, aside from robotic surgery, you are also using new technology, specifically navigation. How is this helping patients and you as surgeons?
That is correct. So navigation is another tool that we have started using at the Bone and Joint Institute. This is a tool wherein we use non-X-ray or non-CT guided technology to help us accurately position the implants. And we have found that in patients where we cannot get a CT scan, these technologies do help us.
And I would imagine help in recovery time too for patients.
You're absolutely correct, because when we try and perform surgeries which are more accurate, more precise, it leads to better outcomes. And at the Bone and Joint Institute, we have some of the best outcomes we have across the country.
Certainly have come a long way in this type of surgery. Thank you, Dr. Nagarkatti, for joining us. For more information, you can log on to the Bone and Joint Institute at theboneandjointinstitute.org. I'm Hartford Healthcare's Tina Verona.